question.
Thank you, Mr. Chair, and thanks for holding today's hearing. And Mr. Secretary, thanks for being with us today. This administration's forced one-size-fits-all approach allowing Medicare to negotiate drug prices in the Inflation Reduction Act is wrong for patients, wrong for science, and wrong for our most vulnerable. The Orphan Drug Act has been in effect since 1983, and even the IRA included a very limited orphan drug exclusion from negotiations. Unfortunately, CMS has refused to correctly apply the timing provision of the exclusion, leaving uncertainty for companies working to bring rare disease treatments to the market. Yes or no, will you instruct CMS to reconsider its decision relating to timing for negotiations and instead apply the law as intended, preserving the orphan exemption and postponing eligibility for negotiation until the date the first non-orphan indication is granted?
Congressman, it's hard to answer yes or no to a question which you phrase in a way I don't agree. The CMS continues, and all of us at HHS continue to believe in the importance of treatments for rare diseases. And of course, the impact that absence of access to those treatments would cause to a lot of patients and families. We're committed to implement the law on drug negotiations as we must under the law, which means we have to comply with all the laws, including laws that relate to the Orphan Drug Act. So we're going to make sure that we respect the Orphan Drug Act because it's a very important law as we continue to implement under the law the new drug negotiation law.
It's absolutely important that that there's no uncertainty out there for these companies because again, on these orphan drugs, we've got to make sure that they're out there, especially for those most vulnerable who need them. Let me follow up. According to reports, in the last decade, 85% of new medicines entered the American market. What this means is that American patients had access to medicines first. Germany had only 61% introduced locally. Meanwhile, countries like Canada, Spain, Austria, and South Korea fell further behind with less than half of the new medicines available. Briefly, given those data points, are you willing to risk the U.S. patients' access to innovative and cutting-edge medicines if the current price control scheme is implemented and expanded?
Congressman, as I believe you know that the current drug price negotiation law does not include drugs that just barely came on the market. A drug, for it to be negotiated by Medicare, must have been on the market for many, many years. And so those new innovations that you're speaking to would not be subject to negotiation.
Let me just go on because, again, when we're stifling healthcare innovations, often reduce access to new medicines and longer treatment wait times exceeding sometimes in over 500 days. Foreign governments who impose similar price controls cause patients with severe conditions to wait over 16 months for treatment. Has HHS considered how the Biden administration's price controls will impact the wait times for new medicines, treatments, and cures? And let me give you an example. During the work period, the last couple of weeks, I was at 4 hospitals in my district on that period. And I was bringing this up, and one of the nurses, this is in a cancer where they were giving for infusions at this facility, at this hospital, and she said I'm very concerned about making sure that the patients get these new innovations out there because she said that she was a Canadian, that's an American citizen now, but one of her very good friends is Canadian who had to come to the United States to get that life-saving drug that wasn't being offered in Canada. And, it's with these new medications, and, again, as I mentioned, has HHS considered how these price controls will impact the wait times for new medicines, especially when these medicines are so, again, I think about everything in Ohio. I think about all the great hospitals we have, all the people come from around the world to come to the United States, and all of a sudden, if they say they can't get these medications, what's going to happen out there to these people?
Congressman, I know my friend, the health minister in Canada, would probably want to challenge what you just said.
They can challenge me on it because, again, I know that when we were talking about and had hearings, having the information out
health
here
minister would want to challenge you in the way you represented what Canada does.
They had to open up in the United States, different states, to make sure that their patients could be treated because they couldn't get the treatment in Canada, and so they were coming to the United States, to our northern states.
All right, so we can compare notes, but I guarantee you there are a lot more Americans that are going to
I'd be
Canada
happy to
to buy
debate
their
that all
prescription
day,
drugs
because I
than
know
Canadians
that what
coming to
we
the
saw,
U.S.
because then the Canadians had to shut it off because their citizens were coming here, and Mr. Chairman, my time's expired.
The gentleman yields back. The chair recognizes Mr. Cardenas for 5 minutes for questions.
Thank you very much, Mr. Chairman, and also Ranking Member Eshoo for holding this important hearing, and appreciate the Secretary